Republican Congressman Mike Rogers is a cancer survivor, diagnosed at age 19. He says if the government had been running health care at that time, he may not even be with us today. Congressman Rogers, good to see you. Why do you make that claim?
See you. Well, I wouldn't have fit the profile for what a mandated government plan, compensation plan pays for. In other words, if it fits outside of the normal, which is a very cold calculation, some things aren't going to be covered under a government plan. And we see that in Canada and United Kingdom. At age 19, it is just statistically impossible to get bladder cancer. Luckily my physician, Dr. Susan Rose, thank you, Susan, who's diagnosed, she knew me for a long time, said, something's not right. I had a little bit of blood in my urine, more than your viewers probably want to know. And it just wasn't enough, but I was healthy, I was playing football. They said, listen, she said, the other folks in the doctor's office want to say you just got jarred. I think there's something more. I want you to go get tested. Under this government-run plan, it wouldn't fit because, listen, somebody at 19 doesn't get bladder cancer, so we're not going to pay for it. Again, it happens in Canada. There's a young lady who wanted to get her cervical cancer checked early, but they only paid for it after age 25. Guess what? Age 23, she gets cervical cancer. And reason is that the only way the government can control costs is by denying you things, by rationing care. So had they not caught it early, and they did when I was 19, by the time that thing would have spread through my body and they could have found it later on, 22, 23, 24, probably would have been too late. And that's certainly what my doctors told me.
Congressman, what you're identifying there is really a fear that a lot of people have, the limits that would be placed on them in this government plan. Take a listen to what the president has said about what change may or may not come to your specific plan as a taxpayer. Take a listen.
Under our proposal, if you like your doctor, you keep your doctor. If you like your current insurance, you keep that insurance. Period. End of story.
End of story. Congressman, is that not true?
That is not true, and I'll tell you why. It's only true if your employer keeps it. Here's the problem. They have built a perverted incentive system for your employer to drop your coverage. I'll give you a great example. I talked to an employer yesterday in Michigan. He's got somewhere about 800, 900 employees. They pay about $60,000 a piece. It's 15% per employee for his health care costs. Here they say, we're going to penalize you 8%. He said, I'll drop health care in an absolute second. I save 7% on every employee, and they get the government-run health care plan. He said, that's just business. What am I supposed to do? So they've built incentives in the bill to get you off of your private coverage. So when he looks in the camera and wags his finger in the camera and says, you get to keep your health care, that is disingenuous at best. And that's what I'm worried about. People who are afraid, people who are nervous, and there are a lot of things that we can do in health care, are going to jump at this chance to have the government come in, and they will ration care because it's the only way they can do it. And they're going to create this new group, by the way, that's going to absolutely set the prices. I mean, it is really scary stuff when you read this trying to do, and employers around the country are saying, if this is the way you're going to do it, absolutely I'm going to stop providing my care. Then you don't get to choose your doctor, and you don't get to keep your health care.
The White House would say in their defense that they're not forcing an employer to drop the plan. They're not forcing people to go into a public plan. Congressman Mike Rogers, Republican in Michigan, we're going to have to leave it there. Thanks so much for your time.
Thank you.